I am Anne-Kristine Johannessen, and I am a professor in oral pathology. I do my diagnostics at Department of Pathology at Haukeland University Hospital in Bergen, Norway. We receive around 700 biopsies from the oral cavity and jaws every year. Most of these are taken by specialists in oral surgery and oral medicine, but there are also dentists without such specialty that takes biopsies. However, the vast majority of dentists hesitate to take a biopsy and rather refer the patient to a specialist. In some cases, there is a good reason for referring the patient, but in many cases this is not the case. And why is it so? The dentist sees the patient regularly, and accordingly the dentist has a central role in diagnosing diseases in the mouth. Also, patients with symptoms from the oral cavity will in most cases first visit a dentist or dental hygienist. The diagnostic procedure is very complex. I want to illustrate the complexity with this figure. A very important part of the diagnosis is the clinical examination. But this is only part of it. The dentist must collect information from the patient and listen carefully to what the patient wants to explain. If it is a bone lesion, radiographs must be taken, and possibly there may be indications for a biopsy. In some cases, for instance, the blood test may also be taken. It is not until all necessary information is received that the dentist can make a final diagnosis and decide upon what should be the further treatment and how to follow up the patient. So why do dentists hesitate to take a biopsy? The dentist should know the indications for taking a biopsy. This is in principle basic knowledge, but in short, a biopsy should be taken from all intraosseous lesions and changes in the oral mucosa where there is no obvious clinical diagnosis. I will have a separate lecture on indications for taking a biopsy. One important reason for not taking a biopsy is lack of knowledge and experience on how to take a biopsy. It is a surgical procedure, and a biopsy which is wrongly taken may have no value for the diagnosis and may cause problems for the patient. There will also be a separate lecture on how to take a biopsy. Another reason may be that a patient may think that if the dentist starts to cut away tissue and talk about biopsy, this is something that is very dangerous, possibly cancer. It is easier to just leave it in order not to frighten the patient. Dentists often have a very tight time schedule, and the next patient may already be sitting in the waiting room. A delay may be stressful, so it's better to let it go and hope that the lesion will disappear. Some special equipment is needed if you plan to take a biopsy, and the dentist must be prepared. There's a need for the right fixative, that is formalin, and glasses for sending the biopsy, in addition to the equipment like, for instance, scalpel and suture. The case may also be that the dentist is so focused on one specific task, for instance to make a crown, a bridge, an implant or whatever. The rest of the oral cavity, and especially the oral mucosa, is completely ignored. It is therefore wise to have a general routine for every patient so that possible changes in the mucosa are not overlooked. It is also important to know what is normal variance in the oral mucosa and be able to distinguish these from pathological lesions. But sometimes it may be difficult to distinguish, and the dentist may wish to take a biopsy. However, how will the pathologist look upon getting normal tissue as a biopsy? Will the pathologist think this is just normal? Why should this be biopsied? Certainly not. It is the clinician that has the full responsibility of which lesion that should be biopsied, and the role of the pathologist is to make a diagnosis, not to question why the biopsy has been taken. So here is the summary of the 7 reasons. Awareness of these reasons may hopefully be an inspiration to proceed to the next step, which is to, first of all, do a careful examination, learn about indications and how to take a biopsy, and thereafter get the necessary equipment and allocate time for taking a biopsy in the clinical practice. Based on this, I want to summarize the lecture with the two words knowledge and motivation.